Plaque psoriasis is a common form of the skin disease psoriasis, which affects about 8 million Americans. It is characterized by raised red patches covered with a whitish buildup of dead skin cells called scale. These plaques can appear on various parts of the body, such as the elbows, knees, scalp, and lower back, and they can often itch or hurt. Plaque psoriasis is a common form of psoriasis, and it's considered to be an autoimmune disease. This means that the immune system attacks healthy cells, causing new skin cells to grow much faster than normal and build up in thick patches. Whether someone gets plaque psoriasis depends on their genes and health history. It tends to run in families, and about 10% of people are born with genes that make them likely to get psoriasis. However, only about 3% of people actually get the disease. Certain triggers, such as skin injuries, sunburn, certain medications, infections, stress, smoking, or alcohol, can start the immune system's reaction. It's important to note that psoriasis isn't contagious and can't be spread by touch or close contact. People with psoriasis are also more likely to have other conditions that cause inflammation, such as Crohn's disease, diabetes, metabolic syndrome, fatty liver disease, and obesity. They may also be more prone to heart disease, depression, uveitis, a type of eye disease, and psoriatic arthritis, which causes joint pain, stiffness, swelling, and deformity. Your dermatologist, or skin doctor, can usually diagnose plaque psoriasis by talking with you about your medical history and examining your skin. However, since psoriasis can resemble other skin conditions like eczema, it can be challenging to diagnose. In some instances, a biopsy may be necessary. This involves taking a small sample of your skin to examine the cells under a microscope. In small plaque psoriasis, you'll see lots of little lesions, each one no bigger than a few centimeters. They may remain separate or they could merge. The crusty parts on top are pink with a finer grain and thinner crust than in large plaque psoriasis. It's less common to have a family history of psoriasis with this type, and it's more common after age 40. It often responds well to phototherapy. Large plaque psoriasis, on the other hand, has thicker and often larger lesions with more clear edges. The crusty parts are red rather than pink and show a whitish silvery scale. It's more common in those younger than 40, and some studies link it to metabolic syndrome. It's harder to treat than small plaque psoriasis, and it's more likely to run in families. In unstable plaque psoriasis, the plaques lose their clear edges as they enlarge and sometimes join together. New plaques may also appear. Chronic, stable plaque psoriasis is the most common form, with lesions tending to stick around or re-emerge after the first outbreak. They most commonly appear on the elbows, knees, torso, and head and scalp, though there may be other areas too. Plaques tend to emerge on both sides of your body. For example, if they show up on one elbow, they will appear on the other one as well. Psoriasis cannot be cured. It may improve and then worsen again over time. The goal of treatment is to have fewer and less severe flare-ups. Treatment options include topical medications. These are creams or ointments that you put directly on your skin to help reduce inflammation or slow the growth of skin cells. Some examples include corticosteroids, vitamin A, vitamin D, and over-the-counter options like salicylic acid and coal tar. Light therapy. This involves using ultraviolet light to treat widespread rashes. It can be done at a doctor's office or with a special box at home, but be mindful of sun exposure, which can raise the risk of skin cancer. Systemic drugs. If psoriasis is severe, you may need medications that work throughout your body. They can calm your immune system or slow the growth of skin cells, but may come with serious side effects like depression or liver problems. Some medications include acitretin, cyclosporin, and biologic drugs like adalimumab and etanercept. These advanced treatments may be given in the form of a shot, pill, or through a vein in your arm, affecting a specific type of immune cell or keeping certain proteins from causing inflammation. Be aware that these drugs can make it harder for you to fight an infection. Most people with plaque psoriasis have it for life. Here are a few things you can do to manage it better. Avoid triggers like stress, smoking, alcohol, allergies, cold, dry weather, and hormonal changes. Watch your diet by eating healthy and maintaining a healthy weight. Take care of your skin with moisturizer, gentle soaps, and medicated shampoo. Seek emotional support if needed and talk to your doctor about therapy or medication. Work with your doctor to monitor your condition and make any necessary treatment changes.